Hey future doctors, today we are going to see about infarction. It's a very important topic which can either come as a SQ or LAQ. So when by infarct, so it is the localized area of ischemic necrosis which is caused by occlusion of arterial blood supply or venous drainage. And the process of producing infarct, it is known as infarction. So if this is an artery or vein, now here there will be occlusion which will narrow the lumen and due to which there will be the ischemic necrosis. So now here are some causes. The arterial causes are intraluminal, intramural and extramural. So in intraluminal there can be thrombosis, embolism and atheroma. In intramural there can be spasm or sclerosis. In extramural there will be tumor or torsion. And venous veins are intraluminal, intramural and extramural. So again in intraluminal there will be thrombosis, then intramural varicose, and extramural there will be strangulations. So these are some causes of infarction. So now we are going to see about the factors which determine the outcome of an infarct. So general and severe status are anemia, hypoxemia, then heart failure, shock and old age. In old age the people are more vulnerable to hypoxia. It means decreased oxygen level and it will more prone for the infarction also. Then anatomical pattern of arterial blood supply. So the single artery with the anastomosis that is lowest prone. Then dual lung, liver are less prone. As well as collateral, circle of Willis, radial and ulnar artery they are also less prone. Then without anastomosis these are more prone. So these are some anatomical patterns. Now we are going to see about tissue vulnerability. So it is irreversible damage which neurons can occur to 3 to 5 minutes. Then in myocardium it can be 1 to 2 hours. Then in liver as well as skeletal muscle it may last for many hours. The fourth is rate of occlusion, which is so there will be more severe injury in the sudden occlusion. So now we are going to see about types of infarcts. So on the basis of color, it can be divided into white or pale or red and hemorrhage. So there can be white and red. Then on the basis of age, it can be recent or old. And on the basis of infection, it can be septic or bland. Now we are going to see about this in one by one detail. So first is white pale infarct. So it can occur with the arterial occlusion. In the solid organ with the end arterial circulation without a dual blood supply. So this is more prone for the white infarct. For example, heart, spleen and kidney. With the increased density which prevents the diffusion of RBC. So in this case, there will be white or pale infarcts. So if this is a tissue which is highly densed and if this is a capillary and this is a necrotic area, so it will not flow RBCs through this. Then organs involved includes heart, kidney, spleen, dry gangrene of extremities. And gross features are this is usually weight shaped. It is occluded blood vessel is seen at the apex and the periphery surface of organ which forms the wide base. The diagram of an infarct kidney where the weight shaped infarct is slightly depressed on the surface and the apex lies internally and wide base is on surface. And here also you can see that central surface is pale while the margins are hemorrhagic. Acute infarcts are poorly defined and they are slightly hemorrhagic as we saw earlier. Then after 1 to 2 days the infarct becomes soft, it is sharply demarcated and light yellow in color. As time passes the infarct progressively becomes paler and more sharply defined. So this was all about white or pale infarct. Now we are going to see about red and hemorrhagic infarct. Infarct mostly occur due to the venous occlusions, example is ovary. Then in the loose textured tissues, example lung, they allow the red cell to diffuse through and collect in the necrotic zone. So basically as we have seen earlier that there will be tissue which is of high density and it will not allow the RBC flow from the capillary to the necrotic area. But in this it will diffuse this. Okay, dual blood supply, example is lung and small intestine. It allows blood flow from an unobstructed parallel blood supply into the necrotic zone. Then as well as the tissue is previously congested due to the decreased venous drainage. Now here are some cross feature. It will a sharply circumscribed area of necrosis which is firm in consistency and it is dark red to purple in color. So as you can see in this figure. So this was all about types of infarcts. Now we are going to see about microscopy of the infarct, that is the microscopical features. So characteristically shows ischemic coagulative necrosis. Then microscopic features of the frank necrosis, it will appear after the 4 to 12 hours. And acute inflammation cell, it will infiltrate the necrotic area from viable margin all around infarct within a few hours and it become prominent within 1 to 2 days. Granulation tissue, it may replace the infected area which matures to form a scar tissue. And if the infarct is large, such as in heart or kidney, then the necrotic center, it may persist for months. So this is a diagram of renal infarct where the renal tubules and glomeruli show typical coagulative necrosis. There is a acute inflammatory infiltrate at the periphery of the infarct as you can see here. So this is a diagram of renal infarct. This figure that this is a hemorrhagic infarct lung figure. Here the infected area shows ghost alveoli which is filled with blood as you can see here. So this is inflammatory cells, this is a coagulative necrosis and this is hemorrhage. So this was all about infarction.